You know that there's a really simple solution to the long wait times to see a primary care doctor, or maybe if you don't even have a doctor at all. And that is what we're talking about today on Wellness by Design. I'm your host, Jane Hogan, the wellness engineer, and my guest today is Dr. Sandra Scheinbaum. Now, Dr. Sandy has a background in psychology, and she is the founder of the school I went to, the Functional Medicine Coaching Academy. And we're talking today about how a health coach can change the medical model, but also empower you. A health coach can empower you to make the changes that are going to support you in getting healthy again. So I'm excited to share this with you, and I hope you enjoy this conversation. I'll see you inside. I am so excited to welcome Sandra Scheinbaum to Wellness by Design today. Welcome, Sandra.
Thank you. It is such a pleasure to be here.
Well, the pleasure is really mine because you indirectly changed my life. I would never have become a functional medicine certified health coach if you hadn't began the functional medicine coaching academy, which was the program that I did and literally changed the trajectory of my life. So thank you so much for that, Sandra.
Oh, I love hearing that. Thank you.
Well, I'd love to hear about what took you into that. You weren't always running this functional medicine coaching academy. So, what were you doing before that? And what was the impetus for you to start that?
Yeah, so I had started out in career rates as a teacher because back in the late 60s, pretty much three options. You were either going to be a teacher, a nurse, or if you couldn't do those two, then you could go to secretarial school and become a secretary. And so I chose to become a teacher. That eventually led to getting a master's in learning disabilities, and I focused on helping kids with special needs and eventually was teaching teachers who were getting their master's degrees how to teach kids. Now we call them these neurodevelopmental or the name keeps changing, and honestly, I can't keep track. But the condition is exactly the same. It's what we call it today, neurodivergent, for example. But in our day, it was learning disabilities and kids with behavior disorders. And even back then, I was very interested in mind-body connection, which did not have a name, but I started doing stress management work with teachers, for example, doing these workshops for teachers, doing relaxation tapes for kids, teaching breathing. And then I spent many, many years as a clinical psychologist, but I was, again, not that traditional, what you think of as talk therapy. I was more mind body medicine and focusing on what we can change and how the mind is integrated with the body. And I was working with people who had physical conditions who weren't getting any better. Their doctors were referring them to me, and they were saying things like, "Oh, I don't know what this lady does, but my patients seem to get better." And so people who had migraine headaches, for example, or panic and anxiety, and I would teach breathing techniques, used biofeedback. And I was always in looking at the impact of how to teach people. I was doing teaching and various courses on things like self-regulation therapy, which is mind-body medicine strategies, and teaching positive psychology and psychology of eating. And I had people coming to me who had graduated from coaching programs, and they said, we just don't feel competent to really go out and coach. This was around 2013, 2014. And so at first I thought I'd start small and just do corporate wellness in the local area where I was based and train some people who were already health coaches in these modalities, which I had been doing for so many years. And then decided that, well, no, can go bigger, and entered into a collaboration with the Institute for Functional Medicine because I had also taken courses in functional medicine through IFM and became certified. I was actually in the first class of practitioners to be certified. But as a psychologist, there were many things that were out of my scope of practice in terms of functional medicine. But I returned to my roots, which was teaching, and felt that there was a need to train health coaches in this model. And the doctors were on board because these functional medicine trained doctors were saying, yeah, like I could use a coach. And so that's our model. We train people to work as a team member, whether they are having their own business or whether they're directly working for a clinic, a functional medicine doctor. And so that is, we started with a beta class of 26 people in the fall of 2015. And now we have about 5,000 people all over the world. And that is what it is, just brings me such joy to think of people like yourself who found us and who now are really helping people live life happier and healthier.
I love that, Sandra. There's so much that you said in there that I love that I want to touch on. Um, first of all, this whole idea of, I mean, I hadn't even really heard of a health coach before. I had my health challenge and I discovered functional medicine, was working with a functional medicine practitioner. And I was like, I kind of want to study something on this, but I felt like I don't want to go back to school for 5 years. I was 52 then at that point. And she said, well, the Institute for Functional Medicine has this branch that does health coaching. I was like, what's a health coach? I really
Yeah.
didn't understand that model of medicine. And maybe even people listening may not understand that model of medicine and why a health coach is needed. You touched on it a little bit, and I know your book dives into it. Your new book is called Your Health Coach Will See You Now. So let's talk a little bit about that model of medicine and why even add in a coach? Why is that necessary?
So this model of medicine is called listening. It's called having an encounter with another human being, could be virtual, but it is heart-centered.
Yeah.
And it is based on the idea that that person you are with, they can be in charge of their own destiny. They know what's best. And what the coach does is help that process along the way and help people to have that aha moment. Yes, genes are not my destiny. I don't have to just be a victim and think that chronic disease will be inevitable for me just because my family runs in the family, or that my day-to-day habits, the things I do every single day, don't matter and I have no control, or I have to listen just 100% to what so-called experts tell me, but it might not be right for me. So the health coach process is really about listening, asking the right questions so that that person will have that sense of, yeah, I can't control things about my health. And I really matter enough to make those decisions. And often it's very confusing out there. There's a lot of information that's contradictory. And who do you believe? Who do you trust? And one day you see a study about one thing, it's good for you, and the next day, oh, it's bad for you. Well, health coaches help you sort that out. And they help you come to a decision about what's right for you, because both of those might be right. Given food, for example, could be good for you or bad for you, depending on who you are, your unique profile.
Mm-hmm.
And so it is a relationship that is what we call client-centered. And it actually came from therapy, from psychotherapy, a branch of psychology that was called humanistic psychology. Became very popular in the 70s and 80s. And I was fortunate to have learned about that and actually practice it through learned group process. And it was people like Carl Rogers, for example, who really pioneered this notion of client-centered and that change is possible and the person that is always in the driver's seat, that client. And in coaching, we do call these people that we're working with clients as opposed to patients, because it shows that coaches are not practitioners. They're not clinicians. They're not medical doctors. They may. So we have a lot of our students, for example, a lot of health coaches do have a background. They may be medical doctors, nurses, nurse practitioners, for example, but they are coaches when they are when somebody contracts with them to do a coaching session. And I can clear that up. There's a lot of often confusion because we have doctors and other practitioners who come to us to learn coaching skills, and they can apply those coaching skills to have a better alliance with their patients. But you do not need to be a healthcare professional to be a coach, a health coach, and that's because the coach is the importance. What you're really doing is listening and helping people feel acknowledged and understood.
Mm. That concept was such a relief to me when I started in the program because I had an engineering background, and so many people in my little cohort had they were already in the health field, and I was like, who am I to be here? And I don't know this stuff. And then when I heard you don't have to be the expert. In fact, you're not supposed to be the expert, right? It's the empathic listening, it's the reflective questions, it's helping the person understand that, well, actually, it was really empowering for me to understand that the empowering thing is that the person has all the answers that are true and right for
Yes.
them, and so it's helping them discover that. So that was a huge relief for me, and thank you so much for that. And I also love, I found one of the things I really loved every single month was that mind body component of our program. And that's sort of the path that I went down, was this amazing understanding that our mind has huge power over our physical body. And if we aren't harnessing that, well, it's always doing its work, but are we using it in a way that's going to support us? And that's something that we can help people see. So I love that aspect of the Functional Medicine Coaching Academy program. And your background certainly was reflected then in the program. So sometimes, you mentioned sometimes health coaches can work with medical or with doctors, and sometimes not. Like I haven't worked with a doctor. I'm just working on my own. But what does that model look like when someone is working with a health coach as part of a team with their doctor?
Sure. So it usually means that the doctor would either hire somebody, they're employed, or they're an independent contractor, and they would be a part of that team. So the doctor might have his patients see the health coach at the front end when they first make an appointment with the practice. That first visit might not be with the doctor, but with a health coach. They may orient that person to the practice. They become like the concierge, like that person's advocate. And then they may also follow up on the back end. So after you have your consultation, then the health coach follows up. Like, let's say in functional medicine, it's typical to suggest an elimination diet where you're eliminating certain things that many people are sensitive to. It could be wheat, corn, and it's things that often are hard to give up, like chocolate or coffee, for 3, 4 weeks. And so we train people in doing this IFM elimination diet, and those who are working in a practice are going to help, but they don't have to. We have many coaches like yourself who are working out in the community, have their own businesses, and can also support people. And the idea is, though, that there's always a sense of collaboration because, for example, if you want if you think that someone would benefit from a consultation with a clinician who, let's say you're working with somebody who has mold issues or suspected mold. So then you might be the one who refers them. But our doctors, many of them are now working virtually, and they're expanding. There's something else that's going on that I think is very exciting to follow, and that is that many of the larger hospital systems are now opening centers for functional medicine. Cleveland Clinic was the first a number of years ago. They hired coaches, they were trained by us, and they used a group model. So people were waiting to go into Cleveland Clinic Center for Functional Medicine. And so that wait time, they weren't just waiting and doing nothing, they were meeting in groups and the coaches were leading those groups. So that's a model that is very popular, very, very effective. But it really is encouraging to see these major medical centers waking up and thinking, well, we need to do something. Functional medicine, they're going to start these centers for functional medicine. And so we are going to see more and more of that and more hiring health coaches. So I often, get asked like, well, what should I do? And you really need to look at, well, what is your experience with work in the past? Are you somebody who likes you have an entrepreneurial spirit and you really like the sense of completely setting your own hours and being in charge of your destiny? And other people feel like, oh, I feel really comfortable being on a team and having this structure, and often the security of having that employment or a 1099 contract. So there's many ways of working as a health coach, and I think the best is when it's everyone works in collaboration, because even if there are coaches in a practice, but maybe you have somebody patient from that practice has a very need for a coach who really specializes in something. And so then you can still refer out to a coach in the community. It's just like when I was a health psychologist, so I would often see people who there was a strong need for family therapy or couples therapy, and I would refer them to other psychologists in my network. And that is really how you grow and are the best service to somebody, by acknowledging that you can't do it all.
Yeah. And I love that whole program. It's just to me, it opened up so many possibilities. It's what do I want to do? And how do I want to serve people? And that program just gave me the base and the confidence to do whatever I wanted to do, and sort of figuring it out along the way. And I still figuring it out along the way. But I really, really love it. Um, Being a health coach is just so rewarding for me. Sandra, what about, I know there's been like some studies and things now behind this model. So there's evidence behind it. What have you got to say? And what do you know about the evidence that health coaches can make a difference to outcomes?
It is exploding. And a big part of the book is sharing a lot of that research and just name the condition. And odds are really good that there's a study that people do better with a health coach. And so one that just came out, there was one study that I had cited on COPD, chronic obstructive pulmonary disease, and there are a few in the book, but there's a brand new one that even validated the ones, further confirmation. And so they were looking at people who were getting home care, so respiratory care at home. And the study was looking at two groups. One got just the usual care, respiratory care, nothing else. The study group got the respiratory therapy and health coaching. What was really wonderful to see, which an area is so important, quality of life. When you're living with this chronic condition, what happens to your quality of life? It's in the toilet. Well, these people improved when they assessed on markers of quality of life, the inventories that assess this, it went up consistently. And this is what we're seeing. And so this example was with COPD, but we could be talking about Alzheimer's disease. We could be talking about cancer, about heart disease, hypertension. The studies show the usual care versus adding a health coach. Remarkable difference. There's a lot of talk now. Many people are on GLP-1 agonists for weight loss or type 2 diabetes, and they've looked at those who are just drug alone, and maybe they get a pamphlet about lifestyle change, for example, and then those who actually got health coaching and those who got health coaching did better in terms of their responsiveness to the drugs, reaction, as well as the fact that they were able to make an impact on the risk factors of taking these medications. And the most exciting finding, which is again across the board, study after study shows self-efficacy increases. And that is that sense that we talked about initially. I can make these changes. I am in charge of my health. What I do matters. And that is a very powerful sense that that is just priceless. And so if we're going to make any dent in chronic disease reduction, starts there with that sense that I can make these changes and be successful at making the changes.
So true. So you talked about chronic conditions, and we know really that most chronic conditions are not, a single thing happens. It's a result of a lifestyle. And so if we can change our lifestyle, we can effectively change our health. But lifestyle changes aren't easy to make. It's if everyone could do it easily, be no problem. But it's just hard to change habits, and so that's where a health coach can really help. And so you've seen in the evidence that is true. And I love what you talked about there about people feeling empowered, because we have not been taught that, really in our whole, most of us in the medical model that most of us have learned, we're very disempowered. We go outside looking for someone to fix us or hide the symptoms. And I'm not against medications. Of course, medications can help with that. But in the end, it comes down to making changes and understanding, of course, that we are the one that can do that, and actually the only one that can do that. No one else can.
Yes.
So yeah, I love it. I love the empowering message and how that helps people. So tell me a little bit about what else you cover in your book.
I talk a lot about some of the critical issues facing primary care in particular. We are facing a perfect storm. We have older doctors retiring. Younger doctors in training are not choosing primary care. They're going into specialties like dermatology, orthopedic surgery. And at the same time, we have people getting sicker and sicker. And it's said that only 7% of adult Americans are metabolically healthy. And we don't have the resources. The costs are going up. We have an aging population, more demands on our primary care system. Good luck finding a new doctor if your doctor retires or you're moved to a new community and you want a new doctor. And yes, we have digital care, and that's so necessarily you're not bound by your geographic region anymore. But still, the wait times are quite long in cardiology. I've heard like 6 months to 8 months. And many doctors who are in primary care have chosen to go to boutique type concierge model practices. They're private pay, they're a membership fee, and often they're closed. They're at capacity. So even if you have the means to pay, you can't get in. But of course, those who don't have the means to pay, when they see a provider at all, they're given 7 to 15 minutes is a lot with somebody, and these doctors, and not that they're not caring professionals and want to serve their patients at the highest level, but they are hampered by paperwork. It's not paperwork, it's computer work, but they're often overwhelmed. They get burned out. I was talking to the chief of medical staff of a very large hospital in my area, and he said our doctors are just exhausted and burned out. And so, what's the solution? Well, doctors are not trained in lifestyle medicine, and so even if we were to have all medical schools, as been recommended, have nutrition, which is important, but how are they going to, if the current situation continues and is dire, how are they going to have enough time? And also, it's more than just taking one course. It's really what we're talking about is how to encourage somebody, how to help them make these changes. And it's not just nutrition, but it is movement, it is stress, which is overwhelming, it is getting good sleep, having relationships that are meaningful. We're losing community engagement. And so it's all these factors. Well, that's where the health coach comes in. If every primary care practice had a health coach, we would see dramatic reductions in chronic disease and lower medical costs.
Mm-hmm. So do you think, Sandra, are you seeing a change that even like in conventional medicine, adding health coaches to their team?
So we are on the cusp of this happening, and it really is behooves everybody who goes to their doctor to say, "Hey, do you have a health coach? Can you?" And if they may say no. Well, can you refer me to somebody in the community, or something? It is really consumer driven. And so
Mm.
everybody who may be listening and think, "Oh, yeah, I would love to work with a health coach," they can find one, and then they can encourage their doctor to have a health coach in their practice.
Mm. I love that. I think that is the future of health for sure. All right. So we talked about lifestyle changes. And actually, when you were talking about all those different things, I was thinking also mindset, changing the way
Yes.
we think can really just change our physical outcomes because I don't know, I've interviewed over 200 people on my podcast.
Mhm.
I've interviewed a lot of people for my two summits that I've hosted and medical professionals and I've listened to a lot of podcasts as well and a lot of doctors and much of uh, our health challenges come from stress and stress isn't the event, it's our response to the
Yeah.
event. And of course the response is there's a choice there, even though we don't always think there's a choice, but there is a choice there. So that mindset part about choosing our response and how we changing how we think, how would you sum that up for people and how that impacts their health?
Well, in a nutshell, what's real in the mind is real in the body. And every thought, every emotion you experience, every interpretation of an event, think of it like a shower of chemicals that is going to impact. It's either going to be inflammatory or anti-inflammatory. It's going to turn on a stress response, which is fight or flight, or it's going to really promote what we used to call a relaxation response. It's a parasympathetic, and that is where you digest your food. It's where your body heals, and it's critical. And we are often in this state of hyperarousal most of the day. And often it is coming from misinterpretations. We're telling ourselves, I have to, I must do this. It's life or death in terms of how we think about it. When we change those thoughts, when we purposely tune in to, oh my God, I'm holding my breath. I'm racing. My thoughts are racing. I'm going to slow down my breath, slow down my thoughts, and really focus on what matters most to me. And then it creates a profound healing response and reverses the stress response.
Mm-hmm. Breath work was something that really stood out to me in the program. And I remember those lessons where you were teaching us breath work. How foundational would you say breath work is to our health outcomes?
It's critical because it is something, and it is critical, but it is also something we have control over. And so we can stop and take the pause. And often the easiest way to access that change process is to start with your breath. And it's very, very simple. And I taught thousands of people breathing techniques, and we didn't call it breath work. It is just breathing. It's really not work. It's just an
Yeah.
awareness, and it feels good. And so it's something that you engage in because it helps to center you. It brings you back to the essence of, because it all starts with breathing.
Mm-hmm. It's the quickest way to shift
Yeah,
that response back to the parasympathetic, the rest, digest, repair,
yeah,
state, right?
exactly.
So good. All right, Sandy, what would you suggest is one thing someone could do today that is going to shift them into that state of healing where they're turning on their body's natural healing ability?
Yeah, well, it is really that mindset, like really having this focus on what matters most and also setting an intention. So every time you get out of bed and your feet hit the floor, you tell yourself today is going to be a good day. And it may sound trite, but you run through, okay, how you're going to make it a good day. It's not just you're willing it and you are it's magical thinking, but it really you can make it a good day.
So it's really about being intentional,
Yes.
it, having the mindset, taking the action to be intentional.
Yes.
That's really lovely. I love that. Sandy, is there anything we've missed today in our conversation that you really want to make sure the audience hears?
That you can make very profound changes in your well-being when you work with a health coach. So I encourage you to try it out, find a coach, and you will not be sorry.
Sandy, tell us about your book, where people can find it, and where people. I mean, I love following you on Instagram because you're always like doing you're lifting weights that look you look at this teeny little Sandy and wonder how she can lift these weights. But let's hear about where people can find your book, which is
Sure.
your health coach. We'll see you now. It's got a longer title too, so maybe you can mention that.
Sure. Your health coach will see you now, creating a healthier future together. And that's available on Amazon in all varieties. If you prefer Audible or an ebook on Kindle and hardcover or paperback. So it is there. It is also at barnesandnoble.com. Personally, I am Dr. Sandy, SDRSANDI. Functional Med Coach on Instagram, Functional Medicine Coaching Academy. We're on Facebook on LinkedIn as well. And the world needs health coaches. So if you've been inspired, we need millions of health coaches around the world.
And tell everyone where they could get enrolled, like I did, to become a functional
Yeah.
medicine certified health coach.
They can go to functionalmedicinecoaching.org. We have a new class that is starting September. Our classes start September and in March.
Beautiful. Sandy, thank you so much for being a guest today on Wellness by Design. Thank you so much for starting that program that has changed the lives of so many people, me, but also it's not just the coaches, it's all the people that they affect as well. They're the clients that they help, the family members, and then they pass it on to friends. I mean,
Yes.
when you think about this ripple effect you've had in the world, does it kind of like humble you a little bit? Like it's so
Yeah, I mean, that is my mission and purpose to yeah,
well,
it's wonderful to just to see how this has grown and how many lives are improving for the better.
it's wonderful. Sandy, thank you so much for being here today. And everyone watching and listening, thank you for being here. And let us leave a comment so that we know what you're thinking, what your thoughts are about this. And also, maybe you're getting inspired to become a health coach. If you have any questions, I'd be happy to answer them. All right, take care, everyone, and we'll see you again soon.
Thank you.